One of the fundamental beliefs that I have about any sort of equitable work is that you have got to include those individuals who are most represented in the disparities that you seek to address. It is not effective, it's not as powerful, and it's certainly not transformational for individuals to assume the best intention of other people with whom they're not in direct relationship, and not including those individuals in a powerful way of co-creating those solutions. Nobody knows better than the communities that who are represented in disparities about what those barriers are that get in the way of their ability to seek healthcare, for example, to go to the doctor, to get an immunization. Whatever those factors are, the individuals in community best know what those barriers are, and they best are able to articulate what is going to help motivate and change the very systems and culture that results in the behavior change necessary. Because oftentimes, again, back to that limited perspective of what we think we know about community, when we operate within that context, we really very likely uphold a very white supremacist sort of colonial perspective of paternalism around communities that we don't actually know. So in order to advance equity, starting at a place of, again, curiosity, building those relationships, bringing individuals into the table, and looking at the outcomes from the perspective of institutional and individual humility to know that I can only accomplish so much, but if I understand the depth and breadth of the problem, then I begin to understand who else needs to be at the table. So I seek those individuals out, I build those relationships with them, I'm able to think more strategically and often more efficiently about how I can actually address those outcomes so that I'm not putting initiatives in place without them being informed by the individuals who are meant to benefit from them. And I have a better way of being able to assess whether I'm going to have the impact that I desire to have.